So, all right, guys. So, let me get started on this leaflet. So, I have decided to focus on asthma. So, we are going to discuss about how to prepare a leaflet. And as we all know that asthma is a long-term condition and it's a quite common condition. And I think it will be helpful for people to learn about it through this leaflet. At the same time, while writing it as an assignment, you have to follow the guidelines. For example, like 1500 words means 1500 words you have to include in this leaflet, and also have to follow a proper font size, font style, and also it has to be visible. All right. So first of all, what I need or what you need means you need a title. For the leaflet, you need a title. So here I have given a simple title, Asthma Understanding. For understanding asthma, the title should be very simple, eye-catching, but informative. It not to be too fancy. At the same time, it has to be eye-catchy. At the same time, it has to be informative. Maybe something like, as I said, understanding asthma. Or you can also add along with this understanding asthma, breathe easy, live well. So that heading itself will give an impression to your uh, leaflets. Then now let's think about the content. So always start the content with an introduction. So an introduction, you can write what is asthma. So you can simply like it's a chronic respiratory condition that affect the airways, or asthma is a long-term condition that causes breathing problems. It affects airways, making them inflamed, narrow. So from that sentence, hope you understand that how simple it is. It has to be simple, it has to be clear, because you are going to distribute this leaflet to your friends or to your family or to the people those are coming for a GP visit or surgery. Imagine. So normally we will distribute the leaflet in that way. We will not give to any specific group of professional like medical professional. So if you use medical terminologies or jargons, that would be difficult for the people, the common man to understand. All right. Then the leaflet to be person centered. All right. So person centered in the sense it has to be useful for, or it should be useful to all type of people, as I said before. Okay, not only for medical people. It has to be person centered to the person who is reading it. All right. Then you can write the triggering factors instead of writing etiology. So if you are writing this content to a medical professional, you can write etiology. Etiology means what? The medical terminology for reasons. Okay, instead of writing etiology, you can write the triggers of asthma, or the reasons of asthma. You can simply add different things that can cause asthma, such as cold air, exercise, dust, pollen, pets, smoke, or pollution, stress, and strong emotions. So all these words are very, very simple words, right? So these simple terminologies will give more idea to the person. Okay. Then you can write how is asthma treated, how we can treat asthma. So in the section on asthma management or management and treatment, actually this is really important. So people with asthma are usually prescribed inhalers. So there is a blue reliever inhaler which helps quickly during an asthma attack, and there's a preventer inhaler, usually brown, which reduces inflammation and should be taken daily even when you feel fine. But actually, if you write all this information uh, in detail, one leaflet is not enough to explain everything. So you have to highlight the names. Okay. And in this section, you can see how I have highlighted. There's no cure, but asthma can be managed with the right treatment because it is a long-term condition. So if you are submitting this as an assignment to the evaluator, you have to keep the hint that you know what is long-term condition. So you have to specifically mention that this is a long-term condition and there is no cure for this condition, but asthma can be managed with the right treatment. Okay. Then you can write down this management modalities like inhaler. All right. Then how quickly the inhaler will work. Here you can see some description. So like this, you have to add the treatment session of asthma in the leaflet. It should not be too much elaborated. At the same time, it should not to be like nothing. It has to be very informative, clear, and precise. All right, guys. Then now we'll go to the next slide. So in this slide, here you can see when you see your doctor. So that is a very, very important information. So in action plans, okay, in action plans, you can add when you have to meet your GP. That's very, very important. And again, while writing, please write in small bullet points or in simple sentences. Okay. Here I have added a section like encouraging the people to work with GP. Okay. That's very, very important because asthma is a long-term condition. At the same time, there is no cure, but proper management can alleviate the symptoms, or we can help the person to manage the situation. So a personalized care plan is necessary for every patient, depend upon the condition of the patient. So that information you can add in the next slides. All right. So first you have to define asthma, then the etiological factors of asthma. Instead of writing etiology, you can write triggering factors of asthma, then how asthma can be treated, and then you can write an action plan with a catchy heading like when to see your doctor. All right. So in that session, you have to add some very informative information like if you are using your reliever inhaler more than 3 weeks, if the symptom wake you at night, if you feel breathless or tired often, if your asthma is stopping you from doing everything, where to get help. So in the helplines, adding the helplines like NHS, obviously UK NHS is the helpline, the first priority thing when we think about the helplines. So you can write NHS 111, and also you can add the websites from where you will get relevant information about asthma and asthma management. All that information you can add. All right. So then also highlight the symptoms. That's very, very important. So when you highlight the symptoms, add some images which is related to that symptom, then that will be more effective, and that will give more credibility to your assignment. Also, if it is 1,500 word assignment for your any specific module, you have to add that 1,500 word. Then you have to add more content to this leaflet. All right. Then also what you have to do means when you conclude the thing, you have to conclude with a catchy words. Catchy words you have to conclude. All right. Then when you close that's what, when you close the leaflet with a positive message. Also, you can add the anatomy and physiology of lungs to give an idea to the reader. It doesn't mean that you have to write all the information, all the part, you have to mention all the part of lungs. You can give a brief description about lungs, this is lungs and this is respiratory system, etc. And also while writing, you have to write the in-text citations from where you have collected the information, but don't write the content in long or big paragraphs. Everything should be in a precise way. It has to be clear, it must be understandable, it must be precise. All right. And also, as I said, while closing, give a positive message, something like asthma doesn't have a control. Asthma doesn't have to control your life. With the right treatment and support, you can be breathe easy and live well. Or like same like how I have written here, with the right care, most people with asthma live a full active life. Let's take a control of asthma, one breath at a time. All right. So like that could be the conclusion. And again, I'm telling you that you need a solid base on leaflet preparation. You need a solid understanding before starting the preparation. This is not poster. This is not PowerPoint presentation. This is leaflet. If you are unaware about, if you don't know anything about leaflet, search in the website or in the Google. When you type show me some examples of leaflet, then you will get a number of leaflets, and just check the content and the appearance of leaflet. Leaflet means lot of images with information. So images also very, very important. Only long paragraph like essay if you're writing, that is not considered as leaflet. You have to add images, you have to add points, you have to add relevant points. So, okay, guys, I think this gives a solid base, and now you can start working on the actual leaflet and keep it visual, keep it colorful, and keep it easy to understand. And definitely going to add some, you have to add, definitely you have to add some friendly icons, maybe some people of different ages and backgrounds, since asthma affects all ages. So the images also images also images must be clear, and it must be related to the content what you're writing. And at last, if it is an assignment, definitely you have to add the references that should be in other page, not in the leaflets. Okay, so just 3 slides I have shared here, but if it is a 1500 word one, you have to add more images, but it must look like this. That's the only thing I want to say you. It must be look like this. So hope you understand, guys. So it has to be like this. So this is the front page, the starting page. You can see the images. So along with writing, please add the images. So from this image, or while seeing this image, automatically the evaluator or the reader or the viewer will get an idea on what is asthma or what is the meaning of asthma. And again, don't use complicated terminologies, use simple terminologies, and count the words, word count. If it is an assignment for 1500 words, you have to include all together. So in that case, along with this leaflet, you can add the anatomy and physiologies, and also you can elaborate this treatment session. All right, guys. So that is about how to prepare a leaflet on asthma. So for all the disease condition, it is like that. So you have to select a disease condition. You have to read the assessment guidelines. For example, it is 1500 or 2000. Just keep that point in your mind. Then start preparing. You can use websites like Canva or any TikTok chart and all for preparing this leaflets. And while preparing, understand the condition, create a solid base, and after that start preparing. First collect the content, okay, prepare like points, then you can select the slide and you can paste this content onto the slide. All right, guys, thank you.